is Darryl Knight. I'm the Vice President of Research and Academic Affairs at Providence Healthcare. Also President of the Providence Healthcare Research Institute, also known as Providence Research, and I'm an Associate Dean of Research in the Faculty of Medicine at the University of British Columbia. So as the Vice President of Research, I have the privilege of looking after the research community within Providence Healthcare, and that extends from 5 very well-known research centres, universally known, as well as a growing number of independent clinical research groups that exist within the Providence Healthcare families. I still have some research that is going on back in Australia. And I guess that's the link to not only DASH, but to the data-driven science approach that's on at Providence Healthcare at the moment. And so what we've been doing is looking at trying to understand the natural history of a disease while looking at the organ of interest. Looking at the organ in isolation only gives us an idea of mechanism. But if we had an understanding of the health journey of that patient, forms so much more of the mechanistic studies we're doing. And so we started up a program in my old institution where patients who were admitted to the IPF program, we would study them over their 2 years as part of their clinical course. And then when they had a lung transplant, or when they unfortunately passed, we had consent to use their lungs in our research. So we had 2 years of detailed clinical history, and we could marry that up with the multi-omic data that we were generating on the lung. Now, when the patient donates the majority of their lung, there are areas of diseased lung, but there's also areas of normal lung. And so we can interrogate those separately, and we can piece together the data. And that gives us far more power in our analyses, knowing the decline of the patient's lung function, how quickly it declined, what sort of other clinical comorbidities the patient had that may impact on the results we're seeing. Vision for IHID is to be the mechanism by which clinical data and research questions come together. IHID exists to be a tool to generate rich, complex data sets, multi-dimensional, multifactorial data sets. And the bit that I've sort of touched on, it'll become a crucial part, is intercalating data from biobanks. That marriage of the biospecimen and the electronic health record data, which we think is going to be so key moving forward.